My name is Linda and I am being looked after by the Proactive Care team. When I first moved to Hythe, I was although I had COPD, I was fairly active and I could rush in and out of from room to room in the house and walk a little bit up the hill. But not about a year after I moved here, I developed all sorts of different illnesses that I was diagnosed with. I already had the COPD, which was slightly getting worse, and then I was diagnosed with osteoporosis, lymphedema in the legs, and generally going downhill. The day after I came home from hospital, the Proactive Care team, Claire Morgan, who was the matron of the team, she came along to visit me and asked me, chatted to me and asked me about my needs and, you know, and how I felt, and I think what she was doing was assessing how weak I was, and I was fairly weak, and she suggested that I would need some carers to help me wash and also to cook some meals for me and get my breakfast in the morning. At first I was quite reluctant to do that because I felt, I should be independent, but I realised then I was too weak and wasn't able to help myself really. That they'd already got me a hospital bed earlier, and I couldn't sleep in it. Still reluctant to go and sleep in it. But Claire insisted that she made the bed up herself. Said, you must sleep in this bed because you're not going to get strong. You're not going to get better unless you have a good night's sleep. And that's what I did. And I'm really grateful she said that to me, because I've been able to sleep better rather than being in the recliner all the time. The Proactive team were very good. They are very kind towards me. They mentioned about, you know, if I can't get around easily around the house and that, to have the Zimmer frame, and also to have like a perching chair for the kitchen, because I couldn't stand up and wash the dishes anymore. The Proactive team are very good in the way that my leg was leaking a bit a couple of times with the Activac machine. It went wrong sometimes, and I could ring them up day or night. I've had to ring up in the middle of the night before, and they've come out to help me. And the other thing that's happened to me was the walker that was delivered not too long ago. Enabled me to get out to shop with my daughter, and it was marvellous to go around the shopping centre in Folkestone with my daughter and the children, and just to have a bit of normal life again. Today I feel a lot stronger and I can get around better with all the equipment that I've got to help me from the Proactive Care team. And also it was really reassuring to know that the GP gave up at least half an hour of her time to come and see me with Claire to review my health.